In this video, I will be talking about use of metformin in women with polycystic ovarian syndrome patients. Metformin is the most commonly used insulin sensitizing agent in women with PCOS. About 10% of lean polycystic ovarian syndrome patients do have insulin resistance, and this goes up to 40% in women with body mass index more than 30 and above. And one way to tackle this is to consider using metformin. Now, how do we know that a given patient has insulin resistance? One can suspect insulin resistance if patient has classic polycystic ovarian syndrome features and has weight issues, and also by measuring fasting blood sugar levels, and if they are more than 5.2, then it is highly likely that given patient has impaired glucose tolerance and has tendency for type 2 diabetes. Now, when it is decided to use metformin, it is usually used in a stepwise manner, meaning that you start with smaller doses and then increase eventually to 1500 milligrams per day, and this is used in a slow release form of tablets. Now, what are the side effects of metformin? Metformin is known to cause bloatedness, nausea, vomiting, and loose motions, and these are especially common in the first few weeks of starting treatment. The other common adverse effect is vitamin B12 deficiency, and it should be remembered that before starting metformin, patients' vitamin B12 should be measured and then repeated after 6 months to see whether patient on metformin has started developing vitamin B12 deficiency. And the other question commonly asked is patients do fall pregnant with metformin. The question is whether is it safe to carry on taking metformin in the early pregnancy period or to stop. The answer to this question is metformin has not been licensed to use in the early pregnancy if patients are not proven to be diabetic. But on the contrary, if the patients are type 2 diabetic, so the benefit of carrying on taking metformin is more than stopping it. What about using metformin as a sole agent to lose weight? The answer to this question is metformin should not be used as a sole agent to achieve weight loss, and in the scientific data it does not show that it will work this way. What does it show is that patients who have shown determination by the form of diet and exercise and they need extra help, and in such situations metformin does help. Hope you find this video useful.